Hello, and welcome to this comprehensive training session on SS-31, also known as Elamipretide, a mitochondrial-targeted peptide with exciting therapeutic potential in addressing mitochondrial dysfunction and oxidative stress. During this session, we will explore its mechanism of action, clinical applications, dosage protocols, risks, benefits, alternatives, and patient considerations. Additionally, we will review 3 clinical case studies and discuss recommended laboratory evaluations to ensure safe and effective use. Let's get started. SS-31, or Elamipretide, is a synthetic peptide composed of 4 amino acids: D-arginine, dimethyltyrosine, lysine, and phenylalanine. It is unique because it selectively targets mitochondria, specifically the inner mitochondrial membrane. SS-31 has been studied extensively for its role in mitochondrial protection, improving energy production, and reducing oxidative stress. These properties make it a promising therapy for conditions characterized by mitochondrial dysfunction, including aging-related diseases, neurodegenerative disorders, and cardiovascular conditions. SS-31 works through several critical mechanisms to protect and restore mitochondrial function. Mitochondrial targeting. SS-31 binds to cardiolipin, a phospholipid unique to the inner mitochondrial membrane, stabilizing and protecting mitochondrial structure and function, reduction of oxidative stress. By scavenging reactive oxygen species, ROS, SS-31 prevents oxidative damage to mitochondrial DNA, proteins, and lipids. Improved ATP production. SS-31 enhances the efficiency of the electron transport chain, increasing cellular energy, ATP production, anti-apoptotic effects. By reducing mitochondrial permeability transition pore opening, SS-31 prevents apoptosis and cell death. These mechanisms collectively improve cellular energy, reduce inflammation, and protect tissues from damage. SS-31 has shown promise in a wide range of clinical conditions, including age-related diseases, improves mitochondrial function, and reduces oxidative stress associated with aging, neurodegenerative disorders, potential benefits in diseases such as Alzheimer's, Parkinson's, and amyotrophic lateral sclerosis, ALS, cardiovascular conditions, enhances myocardial function in heart failure, ischemic heart disease, and other cardiac conditions, muscle disorders, improves muscle strength and endurance in mitochondrial myopathies, chronic fatigue syndrome, CFS, addresses mitochondrial dysfunction contributing to fatigue, kidney disease, investigated for its potential to protect renal function in conditions like diabetic nephropathy and chronic kidney disease, CKD, ocular disorders, studied for its protective effects in age-related macular degeneration, AMD, and other retinal diseases. Benefits. The potential benefits of SS-31 include stabilization of mitochondrial structure and function, reduction in oxidative stress and inflammation, improved energy production and cellular metabolism, protection against tissue damage in conditions of ischemia or oxidative stress, potential slowing of disease progression in neurodegenerative and age-related conditions. Risks. SS-31 is generally well tolerated, but potential risks include mild side effects such as headache, fatigue, or gastrointestinal discomfort, rare cases of injection site reactions such as redness or swelling, limited long-term safety data due to its status as an investigational compound. These risks are minimal and typically resolve without intervention. Alternatives. Alternatives to SS-31 for addressing mitochondrial dysfunction and oxidative stress include antioxidants, coenzyme Q10, ubiquinol, alpha-lipoic acid, and glutathione, mitochondrial support, supplements, nicotinamide riboside, NR, and nicotinamide mononucleotide, NMN, pharmacological agents, metformin or rapamycin for metabolic support, lifestyle interventions, regular exercise, caloric restriction, and a nutrient-rich diet. SS-31 is typically administered via subcutaneous or intravenous injection for age-related diseases and general mitochondrial support. Route, subcutaneous injection. Dose, 10 to 20 milligrams daily, titrated based on clinical response. For neurodegenerative or cardiovascular conditions, route, Intravenous infusion or subcutaneous injection. Dose 0.5 to 1 milligram per kilogram daily for 4 to 6 weeks. For acute conditions, for example, ischemic injury. Route: intravenous infusion. Dose: 2 milligrams per kilogram administered over 1 to 2 hours. Treatment duration: protocols vary based on the condition, with typical durations ranging from 4 to 12 weeks. Long-term maintenance therapy may be considered for chronic conditions. Laboratory testing can guide SS-31 therapy and monitor its effects. Baseline testing, comprehensive metabolic panel, CMP, and complete blood count, CBC. Mitochondrial function markers such as lactate to pyruvate ratio, inflammatory markers including C-reactive protein, CRP, and interleukin-6, IL-6. Monitoring during treatment, periodic assessments of energy levels and symptom improvement. Regular testing of renal and hepatic function in high-risk patients. Post-treatment evaluation. Repeat mitochondrial function tests to assess therapeutic efficacy. Follow-up imaging or functional assessments for conditions like heart failure or retinal disease. Case Study 1, Chronic Fatigue Syndrome, CFS. A 45-year-old female with chronic fatigue syndrome reports severe fatigue, muscle weakness, and difficulty concentrating. Treatment protocol: SS-31, 10 milligrams subcutaneously daily for 8 weeks. Outcome: significant improvement in energy levels and muscle strength by week 4, sustained through week 8. Case Study 2, Heart Failure with Reduced Ejection Fraction, HFrEF. A 65-year-old male with heart failure, ejection fraction 35%, presents with fatigue, dyspnea, and exercise intolerance. Treatment protocol: SS-31, 1 milligram per kilogram intravenously daily for 6 weeks. Outcome: improved ejection fraction 40% and exercise capacity by the end of the treatment period, with reduced dyspnea and fatigue. Case Study 3, Mitochondrial Myopathy. A 50-year-old female with a history of mitochondrial myopathy reports muscle pain, weakness, and reduced endurance. Treatment protocol: SS-31, 15 milligrams subcutaneously daily for 12 weeks. Outcome: enhanced muscle strength and endurance by week 8, with continued improvements through week 12. In conclusion, SS-31 is a groundbreaking mitochondrial-targeted peptide with broad therapeutic potential in addressing mitochondrial dysfunction, oxidative stress, and age-related diseases. Its unique ability to protect and restore mitochondrial function makes it a promising tool for managing chronic and degenerative conditions. With proper dosing, monitoring, and patient selection, SS-31 offers a safe and effective option for improving energy, reducing inflammation, and protecting against tissue damage. Want to introduce peptide therapy to your patients? Get certified with our free course at freepeptidetraining.com.